Hi everyone, this is Neel Raithatha, consultant audiologist and director of earwax. Thank you for joining me in my latest video using the wax scope, where I have a patient who attended with an enormous plug of earwax in their left ear. If you stay tuned till the end of the video, or if you've seen the thumbnail on YouTube, you'll see it's a sizable piece. So I'm just using our medium-sized specular to dilate open the patient's ear canal, which is slightly narrow, and I'm just trying to get a suction grip here. The wax is somewhat dry, and for that reason sometimes it can be difficult getting a suction grip. You can see there where I placed the suction probe, it's slightly imprinted into the surface of the wax, and I'm just giving it a little wriggle. So this wax extends right from the first bend, and we know we're at the first bend, because of all those hairs protruding from the right hand side. And given the size of the plug of wax, I suspect it was extending all the way to the patient's eardrum. So I've got a decent suction grip here, although I think I'm losing it. I'll just jinx myself, haven't I? There we are. So I'm going to get a bit deeper into the wax where maybe I can get a better suction. So I've brought it forward somewhat, and I can feel now I've got a much more secure airtight suction grip, and it's coming forwards. And as I'm bringing it forwards, I have to curve this wax plug in accordance with the patient's ear anatomy. So in the left ear, we enter the ear, then we veer off to the right, and then where the first bend is, and then we veer off back to the left where the second bend is. So as I'm bringing this through, I'm navigating the patient's ear canal architecture and curvature. So you can see there I went a bit further in to get a bit more of a better suction grip, so I can bring this out in one piece. So yeah, that's a huge plug. If you watch till the end of the video, you'll see a still image of that. So you can see the patient's second bend to the left is quite prominent, but we can still see the whole eardrum. Looks healthy enough. So just moving on to their right ear, again, they've got really dry wax keratin here. So I've just adjusted the focus to visualize the wax and keratin near the entrance. So again, it's somewhat narrow at the entrance. I'm just using the specular once more to dilate open the ear canal. And I'm trying to separate this wax keratin from the posterior canal wall because the skin is adhered somewhat. Again, I'm stretching the ear. As you can probably tell by the amount of hair in this patient's ear, they're male. Not to say that females can't have a lot of hair, but in the ear canal, the outer third. But typically, it's more common in male patients, and as also we get older, so more geriatric patients tend to have more hairs. So it's a bit dry, this wax, but I managed to get a decent suction grip. You can see this wax, as it kind of reaches the lateral aspect, it points inward. So there's a section there that I could grip onto. There's a bit of wax just a bit deep in the ear canal. So you can see the second bend on the right. It's quite prominent, but still managed to visualize this. We're going to just remove that safely, and then we're going to visualize the patient's eardrums. I'm just stretching open the ear. So I've just got past the first bend. There's a second bend to the right. You're going to get the eardrum in focus. So that looks really healthy. And then you're going to see that plug of wax and skin that I removed from the patient's left ear. So to the left was where I moved it from the entrance, and to the right hand side where it's darker, it's oxidized, that's where it was extending towards the patient's eardrum. Well, I hope you enjoyed that video, guys. Take care, keep well, and speak soon. Bye.